I'm Peter Stevenson. I'm Chief Policy Advisor for Compassion in World Farming, and I've worked in the field of farm animal welfare for 30 years. The coronavirus that causes COVID-19 jumped from wild animals to people. There's no indication that it comes from farm animals. But factory farming, in which large numbers of animals are kept in crowded, stressful conditions, contributes to the emergence, spread, and amplification of pathogens, both viruses and bacteria, some of which are zoonotic, i.e. they can be transmitted to people. A joint scientific opinion by the European Medicines Agency and the European Food Safety Authority states that the stress associated with intensive indoor large-scale production can lead to an increased risk of livestock contracting disease. Indeed, the last global pandemic before COVID-19 originated in farm animals, in pigs. The 2009 Swine Flu Pandemic led to the death worldwide of between 150,000 and 575,000 people. Pigs can be infected by avian influenza viruses, human influenza viruses, and swine influenza viruses. And pigs act as a mixing vessel in which the genes of these different viruses can be swapped, and a new virus, a mix of human, avian, and pig viruses can emerge. This process appears to have been behind the 2009 swine flu pandemic, which started in La Gloria in Mexico, just 5 miles from a major concentration of industrial pig farms. The Nipah virus in Malaysia in 1999 was associated with the increased size and density of commercial pig farms and their encroachment into forested areas. This led to the transmission of a virus from fruit bats to pigs, and then from them to humans. The coronavirus that caused COVID-19 does not, to the best of our current knowledge, infect pigs, but other coronaviruses are circulating among pigs and can cause serious disease in them. In 2017 in China, a virus was transmitted from bats to pigs, and this caused swine acute diarrhea syndrome, which led to the death of 25,000 piglets. And scientists have warned that such viruses could in future be transmitted from pigs to people. Industrial animal agriculture needs huge amounts of soy and cereals to feed the animals. This leads to the expansion of farmland into forests and other wildlife habitats. Sometimes the factory farms themselves are built near forests. And this leads to closer contact between wildlife and people and can lead to the transmission of viruses from wild animals, probably through an intermediate host, to people. The factory farming sector argues that they are well placed to prevent future pandemics because their biosecurity measures can, they argue, prevent pathogens from getting into their farms. This is something of a myth. Of course, biosecurity is important, but in most factory farms, biosecurity falls a long way short of what is needed. People and vehicles are regularly coming on and off the farms. Feed for the animals has to be delivered. Animals are coming onto the farms and coming off the farms to go to other farms to be fattened or to the slaughterhouse. The ventilation systems are going to lead to pathogens being dispelled into the atmosphere. And this can infect animals in neighboring farms, even people. Large amounts of feces have to be disposed of. And this too is a virus transmission risk. There's another problem. Intensive livestock production is dependent on the regular use of antibiotics to prevent the bacterial diseases that are inevitable when animals are kept in crowded, stressful conditions. This leads to antibiotic resistance developing in animals, and this resistance is in turn passed on to people. And this undermines the efficacy of the antibiotics, which are so critical in human medicine. If we are to minimize the risk of future pandemics and save our antibiotics, we need to move to new forms of farming, to health-orientated forms of farming, in which good health is inherent in the system rather than being propped up by routine use of antibiotics. So what would these health-oriented systems look like? Well, they would avoid overcrowding because this facilitates the spread and amplification of pathogens. They would minimize stress because stress undermines animals' immune systems, making them more susceptible to disease. They would ensure that the animals can engage in their natural behavior, because if they can't, that too is highly stressful. So sows must be able to build a nest before farrowing. Pigs must be able to root, to investigate their world and manipulate materials. There should be, if we want health-oriented systems, an end to the early weaning of pigs, which is highly stressful because it means premature removal from the sow, getting used to a new diet, having to adjust to unfamiliar pigs, and getting used to a new environment. Pigs should not be weaned until they've achieved immunological and nutritional independence from the sow. These health-oriented systems should avoid large group sizes, as these too can lead to spread and amplification of pathogens. They should maintain good air quality, as poor air quality leads to respiratory disease. They should avoid genetic selection for excessive yields and fast growth rates. They certainly should avoid high litter sizes in pigs. These put enormous strain on sows, can lead to poor body condition, making them vulnerable to disease. And for the piglets, particularly those that are born with very low birth weights, they too are in poor health and susceptible to disease. So in conclusion, if we want to minimize the risk of future pathogens and save our antibiotics, we need to completely rethink how we farm animals. We need to develop health-oriented systems in which the animals are in really good health and in which there is first-class animal welfare.